Complications of radiation therapy include fatigue, may be due to anemia, other effects of cancer and/or treatment, including the time treatment takes. For example, these treatments can require a more regular attendance at hospital for several weeks or months. Unless you live nearby, each session can involve travel and/or a whole day out. SIRT and RLT may require a hospital stay. Bone marrow suppression. Radiation therapy can have an effect on how well the bone marrow can continue to produce blood cells. We need healthy blood cells to deliver oxygen and nutrition around our body, help fight infection, and also repair damage and prevent bleeding. If bone marrow production of cells is reduced, this can lead to anemia, reduced immunity, delayed healing, and bruising or bleeding. Altered liver or kidney function. Both the liver and kidneys are involved in the regulation, filtering, and elimination of waste products in our bodies, including products within the bloodstream. Substances from damaged tumour cells and the breakdown of radiation particles, once they have done their job, need to be eliminated from the body, and the liver and kidneys are vital in this. However, sometimes these substances can cause damage to healthy liver and kidney cells, leading to reduced function, nausea, or vomiting. Radiation dose restrictions. If you have previously been treated with radiation and/or chemotherapy, your specialist team will need to consider whether these previous treatments may alter the type and dosage of radiation the treatment will involve. Fertility and/or sexual function. Depending on the type of treatment and the area to receive radiation, fertility and/or sexual function may be affected. This might include the possibility of treatment-related early onset menopause. Pain and/or inflammatory response. The body may see the procedure as an injury. The natural response to injury is inflammation, caused by a rush of protective and repair factors to the site of harm. The tumour doesn't want to be killed, but as its cells are attacked, it may release certain substances that cause inflammation or swelling, which can lead to discomfort and/or pain. Rarely, a more severe reaction may be experienced, as tumour cells are damaged and die. This sudden destruction can cause the release of certain chemicals into the bloodstream that the kidneys cannot get rid of as fast as they'd like. This is called tumour lysis syndrome. Typically, onset is within 1 to 5 days of the procedure or chemotherapy, and severity can range from a few abnormal blood results to the other extreme, which may include renal failure and cardiac disturbances or heart problems. Target site skin reaction. This is more common in external beam radiotherapy, where a specific spot or site of the body is targeted to receive radiation. As the beam passes through the skin, it can cause surface irritation, from a reddening or irritation of the skin to something like a burn. Very rarely this can lead to the breakdown of skin. This is rare. The team giving you treatment will keep a close eye on skin health to prevent this happening. Fibrosis or damage. As previously mentioned, this may be more common in external beam radiotherapy, but affects deeper tissue rather than just the skin surface. Internal radiation therapies may also have an impact on deeper tissue, particularly those with small bowel net and/or intra-abdominal or peritoneal secondary neuroendocrine cancer deposits. In EBRT, as the beam passes through body tissue, it can cause irritation and inflammation, leading to internal scarring. This is known as fibrosis and is a more common side effect in EBRT to the lungs and abdominal pelvic area. In internal radiation therapies, targeting multiple small sites of disease spread throughout the abdomen may have a similar risk for fibrosis, especially in small bowel nets, where desmoplastic fibrosis-like changes may already be present. This could lead to symptoms of abdominal migraine and/or subacute or acute bowel obstruction. Very rarely, myelodysplastic syndrome or leukemia are types of blood cancer that may cause low levels of one or more types of blood cells. You will be very carefully monitored during and for some time after treatment by blood tests to ensure that healthy cells are not damaged. Early detection of any possible changes that may indicate MDS or leukemia will be acted on. With lutetium oxydotriotide, the incidence of MDS or leukemia has been reported as a less than 2% possibility following treatment.